And I asked the senators, where's the senator on that side of the aisle who's got the courage to break from their leadership, break from the partisanship they're exercising on their side of the aisle, to work together to pass health care reform? I asked them, where's the courage? Where are the senators that got courage on that side of the aisle to stand up and work together on a bipartisan basis to get health care reform passed? Where? We on this side reached out our hands for bipartisan agreement on health care reform. Probably to a fault. Probably to a fault. And I say fault because for months and months and months, this senator anyway, stand the hand to work with other senators at a bipartisan basis. I know that the current occupant of the chair very much knows that. He watched this. He saw it happen in the Finance Committee. And Senator Grassley and I worked very hard to get senators on both sides of the aisle to work to pass health care reform. Very hard. Then after a while, we had to work towards another approach. The group of 6, 3 Republicans, 3 Democrats. We worked for days. We worked for months on a bipartisan basis to get health care reform passed. You know what happened? I watched it happen. And those senators there in the room were acting in good faith. They're in good faith. They wanted to mutually work together to pass health care reform. They asked very good questions. Senator Enzi, for example, from Wyoming, very good questions. Senator Snowe asked very good questions. Senator Grassley asked very good questions. We worked to get health care reform. But you know what happened? You know what happened, Mr. President? I could feel it happening. One by one, they started to drift away. They wanted to pass health care reform. They wanted to act on a bipartisan basis, but they were pressured from their political party not to do it. Not to do it. Not to do it. Why are they pressured not to do it? Unfortunately, they gave in to their pressure because their leadership wanted to make a political statement. One senator on the floor here said, let's make this Obama's Waterloo. Health care is Waterloo. They did not want to work with us, that side of the aisle. They did not want to work with us because they thought it's better to make a political statement, attack the bill, attack the bill, attack the bill, attack the bill, in order to make political points for the 2010 election. That's what they were trying to do. I asked Mr. President, where's the courage? Where's the courage? Where's Republican senators going to stand up and say, boy, let's work together to pass health care reform? Where's the senators going to stand up in that style and say, you bet, we want to work together to pass health care reform? This senator tried mightily to get bipartisan support.
Will the gentleman yield just briefly?
From Iowa, who I've been working with for a long, long time, and they just they're pulled away. Senator Grassley, I don't want to speak for him. I know he wanted to get health care reform passed on a bipartisan basis. I know that's the case. But frankly, he got pressured, and he just couldn't do it. I have highest respect and regard for him. He just couldn't do it.
And then, eventually, it dawned on them that my friends on the other side of the aisle wanted to Europeanize the health care system of the United States of America, to cut Medicare.
I'm going to reclaim my time. I
thank the gentleman for yielding.
I want to tell the senator that is not what happened. I was in the room constantly. I talked to those senators many times. That is not what happened. I'll tell you what did happen. Your leadership pressured them not to work together. There is no European-style effort in that room. That is a totally untruthful statement. None whatsoever.
Thank the gentleman for briefly yielding.
We're passing a bill here. It's a uniquely American solution. It provides competition. It helps doctor-patient relationship. So that assertion and working toward a European solution is entirely untrue. It's entirely false. The fact is that those senators did not want to work with us. It's regrettable. It's highly regrettable. And you know what, Mr. President, one of the biggest travesties I think here, there was not a good faith effort on that side of the aisle to come up with a constructive, comprehensive alternative to the Democratic version of health care reform. If there had been a constructive, honest alternative to health care reform, we could have had a really good debate. You know, what's the better approach to solving the health care problems in our country? That did not ever happen. Did not ever happen at all. Rather, they didn't come up. They didn't have anything. They didn't have a health care bill. None whatsoever. The only one that kind of came up a little bit was over in the House, because after all the criticism, the Republicans don't have an alternative. Finally, the Republicans in the House came up with an alternative. It was very small. There wasn't much to it. To be honest, the Congressional Budget Office said it hardly increased any coverage whatsoever. It was not really a comprehensive health care reform bill. And there's been none in the United States Senate on the Republican side. No alternative for a comprehensive health care reform bill. So I just want the public to know that we've worked very hard to get a bipartisan bill. And that side of the aisle started out working with us, but gradually they began to believe politically, this is this person's judgment, believe politically, it would be better for them politically, they do a better chance to 2010 elections by just not working with us, but just attack, and trying to score political points to defeat any honest effort to get health care reform.